I have presented data on the NIVOREN ancillary program. So the NIVOREN trial is a phase 2 real-world trial in France, evaluating nivolumab in a real-world setting. We included 720 patients, and to answer the question of the biomarker of response to nivolumab, we decided to launch a translational program. So in this translational program, we evaluated immunohistochemistry markers, gene expression, blood immunophenotyping. This presentation focused on in situ markers, so by immunohistochemistry. We evaluated immune cells, checkpoint molecules, BAP1, PBRM1, and complement markers. Our main findings is that, first of all, PD-1 is associated with a better progression-free survival, PD-1 high expression in the invasive margin of the tumors. We did not find any significant association with overall survival, but if we look at other checkpoint molecules such as LAG3, we found a tendency to be associated with a worse overall survival, but it was not significant. TIM3 was not associated with outcome, and if we look at other markers, PBRM1, we found PBRM1 loss, protein loss in 15% of the samples, and this loss was associated with a better overall survival. We have a tendency to predict a better progression-free survival, which does not reach significance. And the last markers is AXL. AXL is an epithelial to mesenchymal transition markers, and AXL expression by the tumor cells were found in 45% of the tumors, and this was associated with the worst progression-free survival. So with these three markers, we found some correlation with outcomes on nivolumab on a big cohort of 300 patients of clear cell renal cell carcinoma. So I think we are going to integrate all this data in the near future to better understand the biology and how it works. The advantage of this measurement is we performed immunohistochemistry, so it's quite simple. And now we don't have any biomarkers. We are already reported that PD-L1 was associated with poor prognosis, even in this nivolumab cohort, which is quite surprising. But we can think that in the near future we can do this kind of markers by immunohistochemistry very easily to predict response or not. But I am not confident with just one single biomarker. The idea is to combine all these biomarkers to see if we have the choice to give nivolumab or other drugs. Maybe we can combine these biomarkers to identify if we have to give nivolumab or if we have to choose another treatment such as TKI, for example. No, I think it's exploratory. We have to confirm that, of course. We have to confirm the techniques, the way we measured this protein, but it's quite standard immunohistochemistry. It's not something very original, but I think we have to validate on other cohorts. But we know with PD-L1 that is not so simple. Even if we have some signal with PD-L1, it's not so simple to implement it in the clinics.